Hey everybody, this is Tom Salemi of Device Talks. Welcome back to the Device Talks weekly podcast. We're going to focus on diabetes this week. Our first guest will be Matt Clemente. He is Senior Vice President of Product Development and Delivery at Bigfoot Biomedical. We'll hear about how Bigfoot is helping people with type 2 diabetes. And then a little later in the podcast, we'll play our interview from this week's Medtronic Talks. I spoke with Krista Sugerman. She's Vice President of Global Marketing Communications at Medtronic's diabetes business. And we'll discuss how Medtronic is working to really individualize patient care and really working to understand how diabetes impacts people. Before we begin this episode, I want to remind you that we have two more Device Talks Tuesdays coming up. They're actually coming in the same week. So we don't have a Device Talks Tuesday coming up on December 6th, but you can finish out your year with two great discussions. On December 13th, our friends at APP, or Advanced Powder Products, will talk about how binder jet 3D metal printing can help you innovate faster and meet critical deadlines. And then on that Thursday, the good folks at PSN Labs will put on a presentation called The Changing Regulatory Landscape for Medical Devices, Engineering Devices to Meet Biocompatibility Requirements. So you can register for both Device Talks Tuesdays on devicetalks.com. Registration is free. You can watch it live. You can watch it on demand. So there really is no risk. Just register, learn a lot, and be a better medtecher in 2023. Finally, don't forget, I'm working on the agenda for Device Talks Boston. That is happening May 10th and 11th. Registration will open next month. And we're also putting out a request for proposals. If you want to present some interesting findings of yours at Device Talks Boston, keep an eye out for a news release, and I'll have some more information for you next week as to how you can submit your presentation to present at Device Talks Boston. Now let's get this podcast started. All right, you ready for this?
Ready.
Chris Newmarker, how are you, sir?
Doing well, man. Doing well. Gosh, can't believe it's December. It's December.
It's here. We'll probably have maybe 3 more episodes of Device Talks Week, including this one.
Wow.
Let's see. So December, today's we're recording this on the 1st. So
Yes.
We'll put one out on the 2nd, the 9th, the 16th, and probably the 23rd. I think we could put one on the 23rd.
Well, 23rd.
Yeah.
Sure.
Yeah, and then we'll take the week off in between the holidays, like most people do. So, but we've got some great ones coming up. We'll focus this episode on diabetes. We'll hear from Bigfoot Medical and Medtronic. We've run an excerpt from from this week's Medtronic Talks podcast. So, last month was Diabetes Awareness Month, November. So we're a couple of days late with a diabetes-oriented podcast, but I hope people forgive us.
Absolutely.
We're bringing some solid content. But before we get into our interviews and, of course, the vaunted Newmarker's Newsmakers,
Yes.
I want to introduce a new feature here on the podcast, Chris.
What? What do you got?
Listener mailbag. We've got a listener mailbag.
Oh my gosh, dude.
It's a small bag, but it's a bag. People like mailbags,
It's a bag?
right? Yeah.
Oh yeah. Got a letter opener there. Got a letter opener to get it
A
open.
virtual letter opener, yes, because it was actually a LinkedIn message. It wasn't even a letter. And actually, they'll throw something else too. We met with one of our loyal listeners, Catherine. Talked to her this week. She's talking about having her company be part of Device Talks in 2023.
Fantastic.
So, Catherine, hello. Chris, say hello to Catherine.
Hey, Catherine.
Fantastic, right?
It'd be awesome to have you over. Like this, it'll be great.
That's right. Device Talks Boston is fantastic.
Woohoo.
Have a great time. So our friends at Stryker, we got a message from Tommy Van Galder. He is the Vice President and General Manager at Stryker. And do you know where he works, Chris? Take a guess.
Boy, Kalamazoo.
That would be a great guess, but he's actually in Flower Mound, Texas.
Oh, man,
home of
no
the
way.
OR of the future. Yes, that's right.
That story has gotten a ton of attention on Mass Device.
That's right. It was our number one newsmaker of that week.
Yeah.
And he heard the podcast and says that, and we both expressed a desire to go visit Flower Mound and the facility. And he said, come on down. He said we should come for a visit.
Fantastic.
Flower Mound is 5 minutes from Dallas, Fort Worth.
Oh, there we go.
And He said, we have some killer breakfast burritos made right here every morning in our cafe.
Even better. That is awesome.
Yeah, that's right.
It's great.
Yeah. So we'll see if we can trick our superiors into getting us down to Flower Mound, Texas, and check out the OR of the future. I'm actually would be very excited to see that, and love to see what their vision. We actually will have Stryker represented at Device Talks Boston. I won't announce the speaker yet, but we'll be talking about just that thing at Device Talks Boston. So
that's awesome.
So we're headed to Texas. Chris, going to get us some breakfast burritos.
Good place. It'll be awesome.
Oh.
It'll be awesome.
So, folks, listen to this Newmarker's Newsmakers. If you want to bribe us with food or trips to places, please do feel free to reach out. And who knows, you might get mentioned right here on this podcast.
I still recall you're a big fan of apple cider donuts, right?
I am. Yes, I am. Yep.
Have you ever made them yourself? I mean, do you have a donut pan? No,
I don't see a reason to. I don't fix my own car, Chris. I don't make my own donuts. There's people who know what they're doing in that regard, and I let them do it for me. It's great.
I did a little of my own car fixing when I was young. I don't do it now. But,
you built washing machines though, Chris, or dryers. Were you dryers or washing machines?
Dryers. It was dryers.
Yeah, dryers. Yeah. So I mean, you're a handy man.
There you go. So back in the day, I changed my own oil and on a Datsun 380.
I tried that once
1980.
on my 84 Ford Escort, and I was underneath, and I turned the filter.
Oh,
and, who knew that oil would pour out all over my chest? I mean,
wow.
Yeah.
That must have been fun.
That was the first and last time I ever changed my own oil.
Yeah.
I'm like, I can pay someone $20 to do this, and now it cost me a shirt. So I figured it was a wash.
I learned the hard way that you can actually get a special wrench to take the filter off. You don't need to struggle with your car jacked up above you.
Once again, it's like I'm going to get the special wrench, and I'm going to put it somewhere, and I can't find it. I'm going to spend an hour looking for the wrench, and I could just be sitting in my car listening to a podcast while someone else changes my oil.
But anyway, Flower Mound sounds awesome.
Flower Mound sounds great. Burritos sound great. We don't need to shift into donut mode. We're in December now, and I think a burrito in the coldest days of February in Dallas and Flower Mound, Texas would be fantastic.
Sounds like a plan.
Thank you, Tommy Van Galder, for reaching out.
That's awesome.
And we'll see what happens. And
we'll do it. I guess if one of the other editors wants to give it a check out the place, then they could go. We'll see what we do. It sounds like a fun invitation.
No, this is our trip.
No, this is our trip.
Let them get their own podcast.
That's right.
All right, Chris Newmarker.
That's great.
Well, let's. I know you've got a busy day.
Yes.
You were up late last night covering the latest from Elon. Well, I don't want to spoil the Newmarker's Newsmakers. So let's just roll into Newmarker's Newsmakers.
Yeah, I checked out some of his live presentation last night. Elon Musk has his brain-computer interface venture, Neuralink, and this was their show and tell, which was originally supposed to be on Halloween, but he got some guff on social media. I wonder if he could stop that now that he owns Twitter. But anyway, they're saying he delayed this a bit, and they finally did this show and tell. They showed an 18-month-old video of a monkey playing Pong with his mind, and then they later showed a monkey type. They trained the monkey to, type with its mind that, welcome to the to show and tell. So that was exciting.
Oh, really?
Yeah, they taught a monkey how to spell out letters on a screen. And
I have a scene from The Simpsons where they had the room full of monkeys typing, and one of the monkeys came up with the best of times is the worst of times, and Mr. Burns was not pleased with that. Anyway,
he fired the monkey.
Let's focus on this. So now your headline is that they're planning to implant this into a person with the next sometime over the next 6 months.
That's what they're hoping to do. That was the big news out of it, and that they sound optimistic about their work with FDA to get an eventual approval for this N1 implant, which is thin, coin-sized, rechargeable remotely. It looked like they were these electrode-laced threads that went in the brain. They've got a robot, the R1, that's supposed to get these all this into the brain while avoiding the vasculature. Musk was saying that, it was very important for the implant to be thinner than the skull so that, you wouldn't notice that someone had it. And then he jokingly teased with the audience that maybe he had one inside of his brain right now. So, they, talking about, how this could, help treat blindness, how this could, help, people who had, spinal cord injuries. I mean, the one thing though is that, I mean, okay, so they've got, Synchron that has this really elegant idea of putting one of these BCI implants, through the vasculature, like through some like catheter delivery type system. I mean, they did their they announced their first in person implant over the summer, and then you got something like a company like BlackRock Neurotech that's been in this space for a long time at this point. I mean, they recently unveiled the next gen BCI that's like as thin as a piece of lace. It looks like a piece of lace. It's thinner than an eyelash. And, Musk himself was like saying this show and tell was like to recruit talent. I mean, his co-founder left in 2021, Max Hodak, and he's got his own company, Science, and they've got this Science Eye brain computer platform that doesn't require an in-skull implant, and they think this could help with sight restoration for people. So it was like, okay, the show and tell they've got an implant. I mean, but I think I think it'll be interesting to see how innovative it is, because there seems to be a lot of companies doing stuff. I mean,
I think it's good to have a lot of companies approaching it different ways to get as many shots on net. And it's actually good to see Elon Musk working on something like this, as opposed to protecting our freedom of speech by doing whatever he's doing to Twitter. Yes. It seems to be a bit of a distraction. So here's hoping that we get back to stuff like putting people on Mars. Well, Matt Clemente, welcome to the podcast.
Thank you so much for having me today, Tom. Really appreciate you giving us the time.
Before we get into what Bigfoot's working on, and I'd love to understand your path to the company and your path into Medtech. What was it that drew you to the Medtech industry?
Yeah, absolutely. At some point, I feel we're somewhat all the sum of our experiences. So as a son of a mechanic and of an artist and someone who always has had a really passion around biological systems, it's what originally got me into biomedical engineering, and really into the medtech industry was more some of my personal family ties, specifically within diabetes. Watching my grandmother, Rita Clemente, really someone who had no more than a high school education, really suffer with hypoglycemic events and struggling with the care throughout a lot of the late stages of her life. It was really something that a new technology could bring unique solutions to really ease the burden on patients like my grandmother.
So what was your first job in the medtech industry?
So I actually started right out of school at Animas Corporation with Johnson & Johnson, working in insulin pumps, getting to do the initial connectivity between pumps and meters for remote control, and then actually working on the first sensor-augmented integration with Dexcom. So for me, right out of school, while I had some work with them throughout school and drug-eluting stents, diabetes was really my start in space.
So was that intentional? You mentioned your personal connection, and you're right. Sometimes things happen that later you think might have been intentional, but they weren't actually intentional at the time.
So I was actually part of a rotational program with Johnson & Johnson, where it was somewhat an NFL draft, where you got into the program, but then your location, it was a global program, your location, your role. But for me, I always knew that I wanted to be in research and development, that I wanted to be in medical devices, and that I wanted to be in diabetes. So those were the preferences I kind of gave in that order. And the fourth preference I gave was I wanted to be in California, because growing up in Southern Florida, the only place cooler to me in the U.S. was California. So I got all of those with the last, and I went to really kind of almost a hometown of mine in Westchester, Pennsylvania, where Johnson & Johnson had just acquired a small pump company, Animas, and got to work with a really talented team there that was already starting to look at the space in a very different way.
So professionally, you've sort of grown up alongside the diabetes industry. We've come a long way in those 20 plus years. What's the journey been like for you?
For me, it's been so exciting, because I think specifically on the type 1 side within pumps, there's been a lot of pretty incredible improvements. When you look at just some of the regulatory, technological, and somewhat market changes that have happened with closed loop pumping, it's very exciting. However, I don't think there's been the same level of innovation and change within the type 2 MDI space. And that's why I'm so excited for the work going on here at Bigfoot and along with others.
That's great. Well, let's talk about your move to Bigfoot. You joined in 2021. What was the opportunity, or the I think we're getting into that, but what was it that drew you to join the company?
Yeah, absolutely. So I've been able to work with alongside Bigfoot for quite some time now. So originally, the founder of Bigfoot, Jeffrey Brewer, really got started in the space as a father of a Type 1.
Mm-hmm.
And prior to Bigfoot, he was the CEO at JDRF, and he was actually the one while I was at Johnson & Johnson. And while Ian Hansen, my colleague here, who's our chief operating officer, was leading the pump division at Medtronic, Jeffrey was on the nonprofit side, helping raise funds to really support closed loop development, as we had multiple challenges in enabling those programs internally in those organizations. So he was on the other side of the fence, bringing funding our way. And that's when he connected with Brian Maslish, who also father of a Type 1, started really the DIY movement within pumps and was the first to hack together the Medtronic and Dexcom systems to offer that to his family. So that's actually where Bigfoot gets its origins, where Wired Magazine did an article around Brian, where they were looking for this individual, this team who first hacked together these systems. And as they were hunting around downtown Manhattan, they said it was as hard as trying to find Bigfoot. So at the time, Jeffrey and Brian and John, who's the third in that trio, renamed the company Bigfoot, and I've been following them ever since. So obviously, having led the development efforts around closed loop pumps and pens and combination products at both Eli Lilly and Novo Nordisk, between those roles, I was able to come out and support the team here as they were really resetting some of their strategy as they developed a phenomenal solution within closed loop pumps. But then really pivoted the organization to focus on really what we believe to be the greatest unmet need in the space today, which is really supporting the rather large multiple daily injection population that's still struggling with adherence and really struggling with glycemic control. And that was really then a few years back where they then continued to develop Unity and certainly stayed in touch with the team here. But as they further developed that product, they took some very novel approaches that were much more geared towards the needs of the Type 2 market than others in the space were taking. So between that and really what they've been able to do on the data architecture side of that, with the quantum of data that's somewhat unparalleled that we have coming in through our systems here at Bigfoot, I typically throughout my career just try to follow the opportunities where I can do the most good. And to me, it was no question in my mind that the opportunity here at Bigfoot could have the opportunity to impact the greatest unmet needs out there in the market.
Well, that's great. Let's talk a bit about Type 2 and the difference between Type 1. I do often just kind of lump diabetes into one group, and there are two distinct and classified groups of folks. What are the challenges of folks with Type 2 diabetes?
Yeah, absolutely. I mean, the burden's rather significant. And, I think the great thing is there have been phenomenal insulins developed where essentially the insulins work for people with Type 2 diabetes who progress to insulin if they take it. However, a large portion of the population doesn't have the tools that they need to really achieve that level of adherence, or they're also not being prescribed therapeutic doses. So I think a great example of kind of the target population that Bigfoot Unity focused on is my uncle, Joe Clemente. He's been on multiple daily injections for well over a decade now. He's actually even been utilizing a continuous glucose monitor for probably over 2 years now. But those are fixed dose injections. He's not even prescribed a correction factor based on that glucose value. So while he's getting the benefit of the monitoring of a continuous glucose monitor, he's not getting the therapeutic benefit of it. And I think this isn't a corner case within Type 2 diabetes, specifically with the population that we're focused on, where our average age is over 60. Although we serve Type 1 and Type 2 patients, roughly 85% of our population is Type 2. And there's somewhat of a dichotomy in the treatment of these Type 2 patients, where the clinical inertia by providers and somewhat insulin omission, those on therapy, just results in poor glycemic control. And a lot of this is, somewhat to manage the risks that exist. So providers are somewhat reluctant to intensify insulin therapy because of the risk of hypoglycemia, as well as, there's often patient resistance, where sometimes the escalation of therapy could be seen as a failure. and they don't have the data of actual accurate dosing, where sometimes the information is either lacking or the discussions between the doctor and the patient don't necessarily reflect, the true dosing habits. So there's a fear of intensifying therapy, probably at the most appropriate time, or intensifying to the most efficacious dose because of the risk of hypoglycemia. I think on the patient side, we see that it's quite regular for people to forget take doses. And again, this isn't because these patients or these people with diabetes don't want better control. They don't want improved health outcomes. It's because they haven't been given the appropriate tools to manage what is a really burdensome disease state and also burdensome solutions in managing that. So I think right now, the existing approaches really focus more on data, not really therapy adherence and tangible outcomes, where you have a lot of disconnected glucose data sources. Most of the insulin dosing instructions come to patients usually on paper, and there's really not smart solutions that are bringing that dosing data together with the glucose data, much less the dosing data with the glucose data and the actual therapeutic interactions, where a lot of patients change the insulin they're prescribed. They have constant changes to their settings. So I think that's really a problem space that Bigfoot Unity is most addressed towards. And really these fragmented device and software solutions really aren't working in tangible ways. And I think that's really the focus of the Bigfoot Unity system is bringing in a holistic solution that connects the HCP, the healthcare provider, and the patient in a much more meaningful way and gives them a much more integrated, simple to use, robust tool set that can help them together work to improve adherence and overall reduce risk for hypoglycemia and support better control.
Well, what are the challenges of engineering devices and solutions for the type 2 diabetes group? Because it seems like there's a lot of variation in approaches and sounds at least a lot of uncertainty sort of on what's the best way to manage the disease. Is it uniquely challenging to be designing something for the type 2 diabetes population?
I wouldn't say uniquely challenging because it's something that we actually are really passionate about and truly enjoy. But I think your whole point is spot on, where we can sometimes, on the engineering side, we can certainly nerd out and come up with some really cool technology. None of that really matters unless we understand the problem that we're trying to solve.
Right.
And if you look at the needs of people with diabetes in a whole, and you really understand that problem space and you go develop a solution for it, you somewhat develop a solution that's forced to your least common denominator, which a lot of times isn't, the patient that struggles the most in control, but it's actually the patient that needs the highest level of control, which sometimes comes down to type 1 patients. Your type 1 ultramarathoner, as an example, probably has some of the most unique challenges. But if I were to design a system that meets that patient's needs, as well as right now we have patients that are 87 on the product, right? Those solutions would look very different because their needs are inherently very different. So that's where I think, Bigfoot's really focused on understanding the unmet needs within this particular type 2 population, and has really developed the first system that's actually designed for these users and bring some of their needs to the forefront of the trade-offs you're forced to make as you're architecting, especially very complex systems where you have a lot of interconnectivity. And I think that's really one of the differentiating factors of the Bigfoot Unity system.
Interesting. So let's get a little more specific into what it's comprised of. I see that you've got the Freestyle Libre 2 device in there. I'm looking at your website, and you've got a kit, a kind of a box full of things. Can you walk me through the Bigfoot Unity diabetes management system?
Absolutely. And I think that you're spot on looking at it is it's really around a solution versus it's not a sensor, it's not a meter, it's not pen caps, it's not a software solution. But it's really first of its kind, a solution that brings together connected smart insulin pen caps that deliver on-demand dose recommendations, integrated with a cloud-based platform that kind of seamlessly connects the data streaming from the caps, which are connected to both continuous glucose monitors as it's cleared with integration with Abbott's FreeStyle Libre 2 glucose sensor, as well as blood glucose data. And it gives all the patient not only all of those components, but a lot of the disposables they need in really an ongoing service model, to then connect patients to their clinicians in real time, and a much richer way to enable a proactive remote care. So a little bit just more about how the system actually works. It actually determines and displays the recommended insulin dose for users. So we have both a white cap, which works for our mealtime insulins, as well as a black cap, which is used for our daily basal insulins. So the multiple daily injection patients that we're serving here are on a mixed regimen of, so for example, if I take my Uncle Joe again, he takes 10 units every mealtime, and then he takes 30 units of a long-acting insulin before he goes to bed. So first on the long-acting cap, it reminds him of when he took his last dose, but more importantly, it gives him contextually sensitive reminders if he misses the dose. So if you're constantly just reminding the patient, hey, it's time to take your dose again, you typically get into alarm fatigue. It's not really effective to actually shift behavioral activity around adherence. However, with our system, where we get to bring the actual data around if a dose occurred, right, we only provide that alert within our long-acting dose, only if the patient's missed it. And it's incredible because we see, approximately 80% of patients responding to those alarms. In a lot of cases, those are doses that would have been missed that directly could impact a glycemic control. On our white cap, then, it's much more integrated with the glucose sensors, because that glucose data can actually be leveraged in that dosing decision. So it really puts right there at the pen, right there at the point of care, clear guidance to the patient as to what their doctor would suggest them to take. So it depends on the particular regimen that the doctor's prescribed to them, but you can imagine it will give them guidance based on their doctor's recommendations as to what they should take if they've had a small or a medium or a large meal. Or it also allows them to then, without doing any mental math of their own, understand if a correction dose or amount of correction insulin is needed based on their current glucose levels. And this is what I was referring to before, where a lot of patients with type 2 diabetes, because of this fear of hypoglycemia and just lack of data transparency between patients and doctors, aren't even prescribed a correction dose. So they may even be leveraging a continuous glucose monitor, but that data, that delta in where their glucose is and what their ideal glucose should be, isn't being even factored into their actual dosing habits. And for a lot of our patients, the mental burden of trying to do that math would be challenging, and maybe led to some of the fear of a doctor prescribing it in that way. And that's essentially what Bigfoot Unity simplifies and automates, where it just brings all of that right to the point of dosing for the patient. So they don't need to open up an app to get that recommendation, because for a lot of our patients or the people with diabetes that we serve, that would be a really challenging ask, and it would continue to not give them the tools that they need for improved adherence and control.
And what does the better management ultimately mean for patients? I imagine they're feeling better immediately, but does it? I'm not sure. Does a mismanaged type 2, is it likely to become type 1? Is it eventually going to become type 1 anyway? But this sort of delays that happening. What is the positive outcome of managing your type 2 diabetes?
Yeah, so very different disease states in terms of where they really come from. So on the type 1 side, it's really an inability. So normally it's an early onset childhood, although there is later onset as well. And it's really the body loses the ability, the pancreas loses the ability to create insulin. So there in type 1, insulin is really required for sustaining life. Within type 2, it's typically later in life. And it's really the insulin that your body creates becomes less and less effective at its job, which is really bringing glucose across cell walls. So your body needs to create more and more insulin to be effective. And in turn, your body continues to become less responsive to it. And you have elevated sugar levels over time. So when I speak to hypoglycemia and hyperglycemia, those are just words for high sugar levels and low sugar levels. Mm-hmm. And they have very different risks. So hyperglycemia, high sugar levels, can really lead to rather significant long-term complications. So people could be pre-diabetic or within diabetes for years. They could be running really high in sugar levels. So a typical range of a sugar level is 100 to 180 milligrams per deciliter, and some patients can be above 300. I've even seen patients above 500. And you will definitely feel it. The way it builds up over time, though, a lot of people don't even notice it. And then they'll get on insulins, they'll get on therapy, and they will have an instantaneous difference in how they feel, the energy levels they have, et cetera. But the greater risk of hyperglycemia is the long-term complications. Essentially, insulin's role is to shepherd glucose across cell walls. But the problem is when you have it built up in your tissues for long periods of time, a lot of the tissues that aren't used to having glucose floating around them deteriorate over time. So macro degeneration of the eyes, nerves. There's a lot of rather significant long-term complications of diabetes, leading to things like diabetic ulcers, amputations, increased risk of cardiovascular disease. So that's where really the goal is to intercept the patient at the right point along that journey to improve the levels of control and sugar, to bend that curve to avoid the rather devastating late-stage complications of diabetes. On the flip side of that coin, hypoglycemia is then when your sugar levels are too low. And that's actually a much more acute, severe risk for patient. And this is what leads to some of the fear, both on the patient and the HCP side, with being too intensive on treating your highs, because of the risk of low can lead to someone passing out, to someone dying. So this is where I remember my grandmother, she would always carry little sugar tabs around her. Now they have glucagon products and other pieces, but that's where, you're constantly, when you look at the number of decisions a person with diabetes needs to make every day, from exercise to what they're eating, to the dose they're taking, to the sugars they're checking, it's just this constant burden of making sure that, you're not flying too high and you're not flying too low, right?
Sure, absolutely. My final question: does your family appreciate your career path and the insights you're bringing to, to whatever holiday table you may be gathering around regarding their diabetes?
Yeah, we've really been focused at Bigfoot on building out with our current clinicians to enable kind of this next level of scale. But so for me and my Uncle Joe, we always have a conversation every time I see him where, again, he actually uses the Abbott sensor today, but he's really dying to get his hands on a Bigfoot system. And so for me, it's just constant strife as to, well, great, when am I going to get access to it? And we're really excited, especially when we look at 2023 for opening up some of that broader distribution to support folks like him.
That's great. All right, terrific. Well, I appreciate your sharing your story, man, and for joining us on the podcast.
No, Tom, thank you so much for the time today. It's been a pleasure just following some of your podcasts, especially some of your recent ones over some of the diabetes leaders. So really appreciate everything you do in the space as well, and look forward to what comes next.
Great. That's super kind. Thank you. Let us move on to number 4 on the Newmarker's Newsmakers.
All right. Well, number 4 on the list, both, GE Healthcare and Philips just, recently were, making some, big announcements around artificial intelligence and imaging technology. There was actually the, Radiological Society of North America annual meeting in Chicago this week. So like a lot of imaging news coming out, but I mean, that was like one of the big themes. GE Healthcare, was talking about its Cigna experience. It's supposed to ensure the smoothest MRI scanning experience for physicians, technologists, and patients. So that was one of their big things. And this has like automated intelligent workflow technology. So just kind of trying to take as many hiccups as you can out of the whole experience of going through an MRI.
No, especially with the workforce issues that are going on, and MRI and CT scan centers being operating at less than capacity because they can't find workers. It seems like technology can really help fill a gap there.
I think it's a real opportunity for Medtech. I mean, like a lot of stuff in the past, we're like, oh, we have a nurse to do that. We have we have a hospital staff to do that. Now it's like, if you can find some solution to automate this for us, there seems to be a lot more openness for that. So it'll be really interesting, and hopefully as we ramp up healthcare in the developing world but elsewhere in the world, this will help make healthcare more accessible to people. So that could be awesome. But yeah, and the other thing was from Philips was they were talking about their Philips Imaging Orchestrator. It's the same kind of thing like Radiology Operations Command Center. Their Philips Ultrasound Collaboration Live, trying to, better using AI-enabled image interpretation technology, to prioritize the patient work list. So some more AI-fueled automation, how we go through all these like scanning processes. So yeah, just very cool.
Now, certainly very cool. Great work from Philips and GE Healthcare. Now let's roll on to number 3 on the Newmarker Newsmakers, Chris.
Well, number 3 on the list, and this is just fascinating because in another week, this would easily been number 1.
Yeah, I actually was surprised it was number 3.
Right? I mean, it's just like there's so much stuff going on this week, and this was big news. Boston Scientific, agreeing to saying they will acquire Apollo Endosurgery for more than $600 million. And the reactions from the analysts, on this, seemed very, very positive. Mike Matson and Needham Company saying like this acquisition is going to complement Boston Scientific's endoscopy franchise, that leverages, Boston Scientific's gastroenterological call point while, offering this expansion potential into surgical endoscopy and bariatric surgery. Truist analysts too are really upbeat about this, and Apollo Endosurgery's portfolio includes devices that are used in like endoluminal surgery procedures. They're closing gastrointestinal defects, or they're, managing complications, or, they're, they're like basically like, folding the stomach and to kind of like shrink the stomach, so that, people lose weight. Actually, if you go to medical design outsourcing, like our managing editor over there, Jim Hammerand, he interviewed a lot of top officials at Apollo Endosurgery just a few months ago. So he ran out a story, like kind of like diving deeper into this technology, like why is this, worth, $600 million to Boston Scientific? But obesity, growing problem. So people are looking for answers, and Boston Scientific is going to get a lot more deeper into that space now through this planned acquisition.
No, that's a space where they're already strong, and this certainly makes them stronger. So great again to see. We talked last week about, I think it was last week, about the price of medical device companies. Once again, $600 million a few years ago would have been a lot of money. Now it seemed like a good price. Although I think at least one of the analysts thought it was a bit higher than they would have expected, but you're right. They were all very positive about what it means for Boston Scientific's bottom line going forward. So
exactly. I mean, sometimes you see an M&A deal, and the analysts are like, "Why are they doing that?" And this is definitely one of these deals. Like, yeah, this makes a lot of sense. And
it was one of those things when you read it, you're like, yeah, that does make sense. It's like, why hasn't that already happened? So good outcome, I think, for Apollo. They've been plugging along for a long time.
Yeah.
And Boston Scientific seems like the perfect home for it. So, all right.
Very cool.
Great item, Chris Newmarker. What is number 2 on the Newmarker's Newsmakers?
Number 2 on the list is that Titan Medical has started a strategic review that it could result in them selling the company to somebody. So this kind of like smaller robotic surgery company. They could get bought, or there could be other options that they end up going with. And I was posting this question on LinkedIn and got a lot of comments off of it, actually. But I mean, it seems like the big question is, will Medtronic buy them? Because they've had a long-standing relationship with Medtronic, and Medtronic's licensed IP from them. So is Medtronic just gonna, I had one person comment on LinkedIn like why shouldn't, I mean, of course Medtronic should, buy them because, you want to like lock in your IP around your own robotic surgery program. So, yeah, it'll be interesting to see what happens.
Why wouldn't Medtronic at least explore it? I mean, they obviously found something valuable about the technology, and if they don't buy it, then that value goes to somebody else. So it seems like it would be a good opportunity for a company like Medtronic that you would presume would have the means to do it, to solidify its position. And they're obviously building a franchise in robotics, and this would be a piece of that. So.
Yeah, it's getting that story is getting a lot of attention. So, it's the robotic surgery space just is getting more interesting all the time. And talking about interesting, our number one item, this was really fascinating too. You've got this really fast-growing British surgical robotic company, CMR Surgical. Their Versius robots aren't in the U.S. yet, but boy, they're they just hit 100 Versius systems, installed across Europe, Asia, Australia, Latin America, and the Middle East. And guess what's happening now?
What's happening, Chris Newmarker?
Now we've got like J&J's Ethicon saying they're going to like partner with them to sell these robots. So,
yep.
They're gonna start out focusing on select hospitals in Italy, France, Germany, and Brazil. Those are pretty big countries. And they're so I mean it's interesting too because I mean J&J has its own. It has this Tava robot, in the soft tissue surgery space it's been working on, but not a lot from them recently about when we're going to see more from that program. But they're working now with to sell these Versius robots along with all the Ethicon stuff that could go along with them, all those types of tools.
We had Per Vergaard Nurseth on, a portion of the interview I did with him last year on the podcast when we talked about CMR. Was it 1 or 2 episodes ago? And he comes from the robotics industry. He clearly knows what he's doing with robotics. And it was interesting to see someone with that skill set and background come into healthcare, into surgery, because you never know how someone who's worked in other industries is going to fare in a heavily regulated industry like medical devices. But they're getting traction, and they've got a very cool approach. And you can listen to the podcast. We'll put it in the show notes as to how they're approaching robotic surgery. But once again, I mean, maybe this is what we've all been anticipating happening at some point. We're going to see sort of a winnowing out of these smaller players getting acquired by bigger players, and really a solidification of these larger players holding a bigger piece of the surgical robotics pie in the future. Maybe this is the beginning of that. Seems to be.
Kind of seems that, Titan Medical going out for sale.
Yeah.
I mean, J&J collaborating with CMR, I mean, you at least have to wonder, where that's going to go eventually. So,
absolutely.
Yeah.
So
here we
surgical
go.
robotics, man. It's where all the action seems to be, at least this week on the Newmarker Newsmakers.
It's a hot space. I predicted it at the beginning of the year that surgical robotics was going to be a hot space, and it sure has come through, and I don't see it stopping in 2023.
Absolutely not. And I continue to look as we've been recording this. I've been looking at your Neuralink post on LinkedIn, and every time I check back, you've got another like or reaction to it. So that one's popping as well. So lots of exciting stuff happening in our industry, Chris. This is pretty cool.
Totally. I mean, so exciting. I mean, I'm starting to help to get the kids to bed, but I sit there and watch like Elon Musk talking about this this BCI because it's just an exciting space, and I want to get that extra mile in, and report what's going on because it's exciting. I love it.
Well, you talk to anybody who's moved from one industry to this industry, and they immediately pick up on the positive feelings of being involved in a product that actually will help people and will do some good, as opposed to just move a box in a warehouse more quickly. Not to disparage those companies, but we're in a special spot. So I don't mind saying that aloud once in a while.
Yes, I totally agree. As someone who, like 10 years ago for a while was covering banking, which, and it feels not, you can get a warm, fuzzy feeling talking to a community banker who's like, oh, I lent this money to help get this going or whatever. That's nice. But I mean, it's just a whole other level when you're, talking to people like, this could potentially help people see again. I mean, this could potentially, radically improve, the life of somebody with a spinal injury for the better. I mean, that's just that's just awesome. And there's just so much potential, right now in the industry. I mean, and if we can just keep on getting our healthcare system to work better, I mean, we can hopefully get more of these technologies to people. And, it could really, stuff that used to scare the dickens out of our parents and grandparents won't be as bad for us or our children. It'd be awesome.
Absolutely. Yeah, we're seeing that in the 2 interviews we ran in this episode, just the good that's being done for people with diabetes who have had to manage their experiences largely alone for so long. They're really getting the support that they need to enable them to live their lives more fully. And we actually, another listener, Marie, she sent a message last week just saying the first podcast she'd listened to was with Shacey Petrovic of Insulet, and now she's got an Omnipod, and she's loving it. So we're seeing this progress happen in real time. So that's exciting.
Just the transformative nature of that. I mean, just the transformative nature of that. I mean, I'm forgetting my car keys half the time. I couldn't even imagine trying to remember when to take my insulin. If I so to have just to automate that process as much as possible. I mean, that's just gotta help so much. For people with that disease.
Yep, and that's actually was the interview I did with Krista Sugerman at Medtronic. They have their Blue Balloon campaign, which is basically encouraging people to go through their day while bouncing a balloon up and down, and it just is supposed to represent the people with diabetes, how they go through life with just this constant task before them of having to manage their levels. So I think there is a deeper appreciation for the impact that disease has, and it's great to see that again. We're repeating ourselves, but it's great to see industry step up. So, all right.
Yeah.
Great stuff, Chris Newmarker.
So come on, keep on doing it. Keep on doing it, Medtech. Let's do it.
Keep up the good work, Medtech folks, in all seriousness. It's great to be a watcher of this community.
Yeah. We're in an exciting space. It's awesome.
And now we'll play our interview with Medtronic's Krista Sugerman. She is Vice President of Global Marketing Communication at Medtronic's Diabetes Business. This is part of our Medtronic Talks podcast. If you're not already a subscriber, please go to any podcast player and you can subscribe to it there and have future episodes sent directly to you. You can also listen to past episodes. We've been doing this for 2 years now. Or if you insist on not subscribing, then go to devicetalks.com. You can find it there. Or go to medtronic.com and you can find a whole page of Medtronic Talks podcast. Now we'll hear a message from the sponsor of that episode, BMP Medical. I am speaking with John Faulkner. John is Vice President of Sales and Marketing at BMP. John, tell us about BMP.
So BMP was founded in 1978. We were formerly known as Biomedical Polymers, and we're an OEM contract manufacturer that provides services to the medical device industry. We provide plastic consumables used in devices and diagnostic kits. We work with our customers from initial design, production, leveraging state-of-the-art injection molding and injection blow molding capabilities to produce an array of components and medical devices. We can offer consultation, mold development, drawing, R&D, tooling, process automation, statistical process control for all of our products. Our facility is equipped with a Class 8 clean room. We have a Class 7 packaging unit, and we have a white room for assembly and packaging as well.
We'll hear more from John a little later in the podcast. If you want to find out more about BMP Medical now, go to bmpmedical.com. Well, Krista Sugerman, welcome to the podcast.
Hi, Tom. Thanks for having me, especially during such an important month. Talk about Diabetes Awareness Month. Glad to be here.
We're going to dive deep into the month and into diabetes and understand it a bit more. But we always love to start these podcasts learning a little bit about our guests and finding out how they found their way to where they are. So what was your first job in Medtech?
First job in Medtech was an inside sales job straight out of school. I went to Indiana, moved to California, having never been here, and having inside sales and medical. But it was a great start where I was able to meet with physicians over the phone, and it was my introduction into Medtech. So it's a company called B. Braun McCall back at the time.
Oh, sure. Yeah. Remember that well. So what was it about was this a career that you're looking for? Or was it just a cool job that you heard about? What drew you into the Medtech industry?
Well, you probably hear this a lot, but at first I thought that I wanted to go into to be a physician and be a doctor, but that didn't. As I started I actually had a family member who was in medical sales, and so I did a field ride with them. And from then I said, "This is great. I get to still have an impact." That was really the biggest change for me, is when I saw, and we went into physician offices, we met with patients, and being able to see that firsthand, I knew right away it's what I wanted to do, but I had to earn my way there through inside sales, starting with.
Was it organic chemistry? Did that do you in?
That was definitely it. So it
seems to take out a lot of
organic chemistry.
That seems to take out a lot of people. So, I should say, that seems to send a lot of great people to the medical device industry. So
yes, sales was an easier path. We'll say that.
Way to go, organic chemistry. So let's talk about the space you're in now. How long have you been? You worked at J&J. You were at Novocept. When you arrived at Medtronic, is that when you started to focus on the diabetes space, or had you been doing that previously?
Yeah, so I've been with Medtronic now for going on 20 years. So really fortunate to work for such a mission-driven company and an industry, like I said, where I get to improve quality of life. So it's very rewarding. Most of my career has been focused on marketing and sales. What I love about that is I've met with thousands of customers from all around the world, with patients and providers, and really get an understanding of what are their biggest challenges and how can we help solve them. So that's what I enjoy. I started with pelvic health many years ago as a sales rep. I was working there to educate and grow awareness of therapy options for bladder and bowel conditions. I loved pelvic health, but I really had a turning point in my career back in 2015 when my best friend's son was diagnosed with type 1 diabetes. I'll share just a little bit of that experience because it's really kind of brought me to where I am. And I very vividly remember watching the concern in my friend's voice. As her family needed to quickly learn and adapt to care for their newly diagnosed son. Almost overnight, they had to start constantly checking blood sugars. They had to learn to carb count, give shots before every meal. And it was just the nonstop worry that I learned a lot from watching them. And her son quickly went on a Medtronic insulin pump. And I remember, and still do, feeling such a sense of pride knowing that the company that I work for was saving her son's life. And that's what she told me. So I still get to learn from their experience, and that helps us continue to get better. But that's what inspired me at the time I was at Pelvic Health, but inspired me to move over to our diabetes business and continue to push for advancements in the diabetes space. And so now I'm happy to lead our global marketing and communications team, and I'm responsible for the customer experience and making sure that our portfolio is meeting the needs of people living with and also caring for diabetes, just like my friend and her son. So that's what brought me here.
We'll talk about the macro impact of diabetes in a moment, but I'd like to focus not necessarily on your friend and her son, but just on the personal impact that diabetes had. I mean, I've got children. When they were younger, one of them had a food allergy, so that was something that you had to manage every day. And that fortunately was not a life or death sort of situation. It was less severe than that. The moment you share the story about your friend's son, I immediately put myself in that place, and I can't imagine having to suddenly be juggling this life or death challenge with your son and having to sort of manage them as well with shots and whatnot. Talk a bit about, if you would, sort of the personal impact of diabetes on families like this, and what the daily impact is like. You've got the Blue Balloon Challenge logo behind you. I've seen videos of that on LinkedIn. But what does getting that diagnosis mean for a mother and for a son and for a family?
It's a great question, one that we have to think about on a daily basis. And
we're going to take a quick break from this conversation and bring back John Faulkner. He's Vice President of Sales and Marketing at BMP Medical. John, tell me, what type of medical device companies does BMP Medical work with, and what services do you provide?
We're very proud of and humbled with our 45 years of experience in helping customers bridge their capability gaps and get products to market quickly. We partner with OEMs, design development firms, growth startups, universities, just to name a few, to develop high-quality devices and components to enhance patient care. At BMP, we offer Class A cleanroom, plastic injection molding. We also do injection blow molding. We do product design and development, cleanroom assembly and packaging. We also do Class 7 assembly as well. Whether the customer has a new concept, an approved design, or design transfer, we work to provide the best solution we can. We're ISO 13485 certified, as well as FDA 21 CFR 820 approved.
And John, I understand that BMP Medical makes devices of its own. Can you tell us a bit about that?
Currently, the business is set up in two areas. So BMP Medical, formerly known as Biomedical Polymers, we have our own line of products. So we've made these products for a number of years. And then the other half of the business is the contract manufacturing. So we provide components that range from IV sets to rapid point of care testing, clinical diagnostics, research tools, general lab consumables. These components are used both in sample prep, rapid detection, and have been a staple for us for over 40 years.
And finally, John, what does the future hold for BMP?
BMP has been always investing our capital back into the business. In this last year, we purchased a few new machines. We put in 4 80,000-pound silos here at the plant. And that's all to help with supply chain management issues that we're all experiencing in the industry right now. One of the things that we've really invested deeply in is our robotics end-of-arm tools for all of our molds and vision systems. And, for us, if we're going to be helping manufacture high-end medical devices, lowering our cost and having great quality are two things that are going to really impact a customer's decision to go with us. And those are the things that we want to focus on moving forward and trying to help our customers with.
Well, thank you very much, John Faulkner of BMP Medical, for joining us on this episode and for sharing your insights. And thanks, of course, to BMP Medical for sponsoring this episode of Medtronic Talks. If you'd like to find out more information about the company, go to bmpmedical.com. That's bmpmedical.com. But what does getting that diagnosis mean for a mother and for a son and for a family?
It's a great question, one that we have to think about on a daily basis. And the reason I think it's important is because I don't have type 1 diabetes, but we need to surround ourselves with people who are very close to it so we can really understand what it's like. And the biggest thing that we constantly hear is it's always having to be on, always having to think about how many carbs am I eating? What am I going to go high or low? How am I, and as you said, in the case of a parent, staying up at night. That was my friend's concern when her son was diagnosed. They were staying up all night. They still, they sleep through the night better with therapies, but she says it's a peace of mind that they want to, and that's what we want to help them, give them that peace of mind. But it's the always on mentality of needing to check your own blood sugars, take care of your children when they go to sleepovers. That's another thing that is really, I know my friends struggled with that, as do many parents, just wanting to make sure that they can constantly ensure that they're providing as much support as possible. Like I said, through the carb counting, through the always on, always having to make sure that they're eating the right things. All of that really plays into the always on mentality.
I can relate to that as well. One of my son's friends would come over for sleepovers and you get handed the EpiPen and you're like, okay.
It's a lot. It's a lot. And that's, I don't know if, now's a good time to talk about the Blue Balloon campaign, but that's why we came up with this. Okay. Yeah. Because I think we want to make sure that we're, again, really representing as much as we can what it's like to live with diabetes. And so we came up with the Blue Balloon campaign to drive awareness through the metaphor that diabetes is a constant balancing act, managing time and range, in addition to everything else that life throws your way. So the Blue Balloon Challenge asks people to bounce a balloon in the air while doing their everyday activities to show how difficult it can be. And we've seen some really creative posts from employees as well as the diabetes community. I did my challenge as well. For mine, I did the Blue Balloon Challenge while at a diabetes conference. It was early in the morning. I was on the treadmill. I was in heels and balancing that balloon, really just trying to, it wasn't easy, but hopefully proving the point of what living with diabetes is really like in that constant balancing act. So we've had a great response, and it forces us at Medtronic to take a pause and just reflect on the really important role that we play, trying to help people living with diabetes keep that balloon in the air. So we're excited.
Absolutely. You referenced earlier, November is Diabetes Awareness Month. World Diabetes Day is November 14th. Let's go through some of the stats you folks had shared. That 1 in 10 adults were living with diabetes in 2021, but a recent publication in Lancet projected that it could be more than double the number of people living with diabetes by 2040, with the largest relative increase happening in lower income and lower middle income countries. So talk about the community, the number of people who are impacted by it, and that really frightening potential for growth. Where are we sort of in the growth of the diabetes space? It sounds like it's in terms of its prevalence, it's going to get worse and not better anytime soon.
Yeah, unfortunately, it's a fast growing problem, and it's especially over the last 15 years, but it's not anticipated to slow down anytime soon, unfortunately. 1 in 10 adults, as you mentioned, in the US are currently living with diabetes. And as you mentioned, that number is expected to double over the next 15 years. What's scary is that it's growing at an even faster rate for children. So that's with Diabetes Awareness Month, and then with World Diabetes Day on November 14th, we're really wanting to spread awareness as well as what signs to look for and to make sure that treatment options and support are well known as much as we possibly can.
How do you engage with the diabetes community? We've talked to a number of people for this podcast and some other podcasts about products in the diabetes space. I mean, speak, if you would, just generally about the community for diabetes. I think it's a very unique group. I think folks have to be more engaged with their devices and with their treatment than any other condition. What is it like to work in this space? And how does that contrast with some other industries or some other specialties or sectors where you've worked within Medtech?
Yeah, the diabetes community is a very closely knit community. And it's out of all of the businesses that we have at Medtronic, it's the community that engages the most with their peers and are making decisions more through online and in some of the social groups. So I think I read a stat that nearly half are going to seek decisions based on what they've heard from their online communities.
Wow.
They're going to Google search. They're going to their Facebooks and really learning from what a lot of their peers are doing as a source of information, more so than any of our other businesses. So we really have to be making sure that we're also in the spaces to be able to educate. So we're very active and have a social media team that can make sure that we're getting our message across directly as much as we possibly can. The Blue Balloon campaign is more to spread awareness, but we also use all of our channel approaches through social media, through a lot of the JDRF partnerships and organizations with other groups like that to make sure that treatment options are well known and that there's education on solutions to really help. And our goal is to make living with diabetes easier. As we know, there's no cure. So we just our goal is to make living with diabetes easier, and we're making sure to use social communities to be able to get the word out.
So social media is certainly powerful, but let's talk about the devices and the management of the disease. I think diabetes space and folks with diabetes have benefited from wider adoption of smartphones, from medical devices incorporating data into their devices. How is Medtronic bringing those technologies online to help people manage their condition?
Yeah. So what you're going to hear out from us is, as well as making it easier to live with diabetes, our big focus is on what we're calling intelligent dosing to make all the experience easier through apps and smart devices. So I'll give you an example with our smart MDI new product focus. You may have heard we acquired InPen a few years ago. Had a solution for people on multiple daily injections that might not be ready or might not want to pump. So the InPen system combines smart pen technology and an app to track how much insulin someone's taking. It can give personalized recommendations and really can help digitize their diabetes management to take away some of that mental burden and that mental math. And instead of having to do manual dose logging, this really helps track that for them through their app. So that's one example. And then, as you mentioned, the community, we're partnering. Now, hopefully you've seen, but we're partnering with Jennifer Stone, who's an actress and nurse here in LA, to really spread awareness on options and her experience on InPen specifically. So that's one way that we're really trying to spread awareness. But for those that prefer an insulin pump, we want to automate the delivery of insulin so that they can spend less time thinking about their diabetes, more time living life. We just launched My Insights, which we're very excited about for our insulin pump users. And that's where we're combining our data and AI capabilities in a program for the first time. So we're really excited. It's a unique program that leverages device data to deliver a monthly report to our users with personalized and key insights that help them adjust their behaviors. It gives them tips. And what's great about it is it also provides motivation along the way through badges and different accomplishments so that they can feel good about even some of the small wins, just some acknowledgement for the work that they're putting in to manage their diabetes. And maybe one example, a customer that's been on our insulin pump for over 20 years, shared. He just started with My Insights. He shared the monthly summary. He shared with me the screenshot of his progress. And what he learned was that he was missing some of his meal boluses at dinner. So My Insights helped him take some action. So we're really trying to leverage, to your question, a lot of the data and AI that we have to provide meaningful support to take away the mental burden for people living with diabetes.
That's great. So the data is not just going into a black box of some kind for the physician. It's actually going into the hands of the people who can adjust or react to it immediately.
That's exactly right. So, and it's the first time that we've really had a big program like this, but more to come. We know that we want to become, our new president's goal is to become the Apple of the diabetes space through our unique data science capabilities.
Medtronic extended infusion set. This is another thing that I'm privileged and blessed to not be managing my own diabetes or someone else who has diabetes. So I'm not aware of even the impact that the infusion set can have and how often that needs to be changed and tended to. Talk a bit about what the infusion set does and what does the Medtronic extended infusion set mean for patients?
So this is an area that I'll just start with that hasn't really seen any meaningful innovation over the last 20 years. It doesn't get talked or thought about much because there hasn't been a lot of innovation in this space.
Sure.
So people think it's got to be changed every 2 to 3 days. And that's what people, on living with diabetes, people on pump therapy are used to doing. So every 2 to 3 days, they've got to change their infusion set, which is really just one more thing for them to think about. So we've got some brilliant scientists who've been working on this for the better part of those 20 years. And we're going to be we've launched in Europe, going to be launching here in the US in November, the first set that will last up to 7 days. And our goal and what some of the feedback from our ambassadors is that it's great to be able to change everything at one time. So they can change their sensor on a Sunday. They can plan it and coordinate to also change their infusion set on a Sunday. And that's something that they've just never been able to do. But it's really driving. We had some market research done beforehand that really showed that that's a reason people will choose and or stay with Medtronic if we can just make daily life easier and extend that up to 7 days. So it improves the overall experience. And we're excited to launch it here during Diabetes Awareness Month.
Sure. No, I would think that would be a huge reason for them to join or to stay with the brand. Could you just tell me what goes into changing a set? Is it inserting a new tube into your wherever it's what goes into it rather than my guessing?
Yeah. And I'll tell you what's changed with the set as well. But so, for those who aren't as familiar with the diabetes space, the infusion set is what delivers the insulin from the pump. And so it's another insertion site that people that were on a pump will have to find a new space to be able to insert it's another injection that they've got to give, another poke. So what we had to change was pretty much everything about the set. So we have new tubing, we've got a new filter, protects the preservatives of the insulin. And we also have a new adhesive that allows it to stay longer without irritating the skin and causing more irritation there. And then also another great advantage of the set is it comes with our Mio Advance one press sorter, which just allows for a more consistent and stable insertion process. So all of that combined, we're seeing great results so far. And like I said, can't wait to make it more broadly available for people in the US.
So currently, prior to this advance, changing a set would require you to remove a tube from an insertion site and to place a new one in the insert. I'm just trying to put myself having to do that every couple of days. That just adds to the onerous quality of the disease. It's amazing.
Yeah, and it's something else that they have to think about every 2 to 3 days on average. So if we can give them that much more time and they can do it at the same time as sensors now, up to 7 days on sensor, they can do it all at one time. It's just one less thing that they've got to think about.
Yeah, I just took a business trip last week and now I'm thinking, all right, you'd probably have to pack 1 or 2 of those depending upon how long you're gone for. And amazing. Well, looking forward, I understand there's been some data collected sort of that has compared the automated insulin pump from Medtronic versus the way that insulin had been injected previously and sort of compared and contrast the benefits or the impact of an automated insulin system. Talk a bit about the Lancet study and where are we headed from here?
Yeah. So I know I've talked a lot about wanting to make it easier through our therapies, but we also want to prove that our therapies work really well. And there are a lot of options out there. So in September this year, our ADAPT study was published in the Lancet. And results, it was meaningful as it was the first of its kind, a randomized control study. And it compared outcomes for those on traditional multiple daily injections and those who are intermittently scanned CGM to those of our next generation insulin pump. And this was just published in The Lancet. It was presented at ATDD and ADA last year, and really encouraging results that could support the use of insulin pump therapy at earlier stages in the treatment pathway. That's really what we're, as we talk about spreading awareness, we also want to share awareness that there's a misconception around patients that need to meet a certain profile sometimes before being prescribed a pump, or they've got to earn a pump. So our goal with this study is to really show that more patients could potentially benefit earlier on from automated insulin delivery. Maybe the last thing I'll share on that is that there's still a number of individuals using an insulin pump worldwide. The penetration rate is still really low when you look at the potential of people that could benefit. So it's studies like this in Lancet, but I think you're going to hear more and more about, yes, the benefits of continuous glucose monitoring, which should be, we think, the standard of care, but also helping to automate those decisions. So a lot more to come in that area.
What is the hurdle that you have to clear, or the resistance that you need to sort of explain away to have folks switch over to an insulin pump? Is there a concern? Is there something they're just wary of? What is the biggest thing keeping that adoption from really growing?
Yeah, it used to be more some on the reimbursement side and just challenges with some of the payers. But as that's gotten easier, I think now it's education on how pump therapy has gotten easier over time. And some in the past have said, hey, you've got to have an A1C of X before you can really get a pump. But that kind of takes away the point of what automated insulin delivery is for, which is to help people that are struggling and may need additional support. So that's one of the misconceptions previously, is you had to be a great carb counter, or you had to, really earn a pump through an A1C that's at a certain level. And it's studies like this that will really show that the benefits of automation, and that's when you ask where we're going. I think that's what we're confident and what we're excited about the future of diabetes is, how do we automate more so that people can think about their management of diabetes less and less? And that's where we think the world's going.
Fantastic. All right. Well, it's important stuff. Glad to see you're making progress, and thank you for joining us on the podcast.
Thank you very much. Great to be here.
Well, Chris Newmarker, it is a wrap. It's time to tell folks how they can find us on social media. Where are you, my bud?
Well, you can find me on LinkedIn, where I currently have 4,996 connections. Woo! So come on, connect with me. I want to get over 5,000.
You will get there.
You could help put Chris Newmarker over the top.
He's a fun guy to follow. You'll get all the latest from Massive Ice. So
absolutely,
actually, including his thoughts and comments on each piece. So absolutely, please connect with Chris Newmarker on LinkedIn. I am on LinkedIn, Tom Salemi at Device Talks. I'm also on Twitter, but I'm at Medtech Tom there, and you're at Newmarker on Twitter.
I'm at Newmarker. So.
Yep. We'll see where that goes. But
we will see where that goes. Yeah.
Don't forget, we've got Device Talks Boston happening May 10th and 11th. We'll open for registration next month in January. We'll have a pretty full agenda up by then, working with a lot of great companies to put some conversations together. So keep an eye on that. We'll have a couple of more Device Talks Tuesdays happening not next week. Well, it might be next week as when you're listening to this. So the week of the 12th, we'll actually have 2 Device Talks Tuesdays. So TWO days. Yeah. Tuesday versus 2.
You're doing a BOGO?
I don't know what a BOGO is.
You don't know what a BOGO is? BOGO? Buy one, get one.
Oh, I know what that is, but I've never called it a BOGO. I've never had to abbreviate that.
Wow.
Yeah. I'm learning so much from you, Chris Newmarker.
You can make donuts at home and you can do a BOGO.
Yes, but in this case, you don't have to bow to go, because they're free.
Just go.
You just ready. You just go. It's a go-go. Yeah.
It's a go-go. Love it.
You can register for one or both, and the price is absolutely the same. Nothing. Just an hour of your time, and you'll walk away all the wiser. So check out devicetalks.com for...
just to clarify with everybody, we're both just drinking coffee.
Yes.
That's all that's happening right now.
We're the only thing that's intoxicating us is each other's presence. We're just uplifted every Thursday when we record these messages.
Exactly.
And finally, Chris Newmarker, what do we want folks to do with this podcast?
You got to like, follow, subscribe.
That's absolutely right. Like, follow, and or subscribe, so you'll receive the Device Talks Weekly Podcast, the Stryker Talks Podcast, the Intuitive Talks Podcast, podcast, and we hope some podcasts, new podcasts coming to you in 2023. We're working on it. I know I've been talking about that for a while. So
it's a smorgasbord of like wonderful medtech content.
Exactly. All right.
Yes.
Well, that is a wrap.
All right,
Chris
man.
Newmarker, thanks for being part of this. Thanks to everyone who's listening. And tune in next week. We'll have another Device Talks weekly podcast waiting for you.
Okay, take care, everybody. Enjoy the winter weather.